Flowers are beautiful. They brighten our homes and are used as gifts for all kinds of occasions. Flowers are also more than just beautiful. They are useful. Bees use nectar from flowers to make honey, one of nature's best foods. But perhaps what you may never have thought as you watch bees gathering nectar from flowers is that modeling disease in the body to the way bees work may have solved the puzzle to curing a condition that only one person in the world is officially recognized as having been cured from: AIDS. American Timothy Ray Brown, sometimes referred to as the second Berlin patient, is currently the only adult in the world officially recognized as having been cured of AIDS. The reason given for his being cured is that a gene with a mutation that makes a person resistant to HIV was introduced into his body. However, a Kenyan pharmacologist believes that this explanation is incomplete. He expounded on the explanation for Timothy Ray's cure and believes that he has cured a further 5 AIDS patients. Understanding how bee colonies function can be used to understand the pharmacologist's theory. Bees generally divide their labor into either worker bees or queen bees. Queen bees are responsible for reproductive duties. Queen bees do not leave the hive. The role is to lay eggs that will turn into bees. On the other hand, worker bees leave the hive to look for nectar necessary to make honey. They may fly in swarms even up to a few kilometers from the hive in search of flowers with the right kind of nectar before flying back. Worker bees cannot reproduce. When bees invade human settlements, smoke can be used to tame the swarms of worker bees. However, a long-term solution to a bee invasion is never complete until the queen bees are either destroyed or the hive containing the queen bees is moved to a safe distance away from the area under invasion. This is because even if the worker bees are killed, the queen bees will simply produce more eggs that will turn into worker bees. Dr. Situma Barasa, a Kenyan pharmacologist, believes that he has cured 5 AIDS patients by using a theory that, in layman's language, can be explained by modeling the behavior of the HIV virus to the worker and queen bee division of labor in bee colonies. Dr. Barasa believes that current treatments for AIDS do not provide a full cure because they only target the HIV virus outside the bone marrow. The bone marrow can be likened to a beehive. The HIV virus outside the bone marrow can be likened to worker bees. Just the same way that worker bees can be tamed with smoke, gene therapy can tame the HIV virus outside the bone marrow. But to truly cure AIDS, one must also destroy the queen HIV virus that is hiding in the bone marrow. This will prevent the HIV virus from reproducing. Dr. Barasa believes that the reason Timothy Ray Brown was cured was because Timothy Ray Brown's bone marrow was removed in preparation for surgery to cure him of leukemia. This removed the queen HIV virus from his body. Continued use of antiretroviral medication for about a year after removal of his bone marrow killed off the remaining worker HIV virus cells. Dr. Barasa tested his theory on 2 patients by using a drug approved for the treatment of cancer in the bone marrow, along with a cocktail of other medications, to kill off both worker and queen HIV virus cells. These patients were independently tested by 3 medical laboratories before starting the tests to verify that they carried the HIV virus. After the test, all 3 laboratories confirmed that the patients did not have detectable levels of the HIV virus. Dr. Barasa published his results in a scientific paper. He then treated 3 more patients. He reported the same success for a total of 5 patients believed cured of AIDS. More work is underway, and it is our hope that the results will be released soon. For more information about Dr. Situma Barasa and his theory, please visit www.kenread.com and choose article ID 126.